Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is Vitamin D Oncology Lie Renounced. This segment is part of my series on the tyranny of lies based on belief without observed evidence. For decades, those who control the thinking of oncologists have muddied their brains to think that vitamins have no role to play in the prevention or treatment of cancer. This is quite a remarkable lie because people all over the world, professionals as well as people who have cancer, have published hundreds of thousands of their studies, either on the net or in the radio format, television format, or in published papers. Now there is a mounting evidence in the peer-reviewed literature that vitamin D has powerful preventive effects for cancer, specifically of the breast, colon. It has actually been estimated by meta-analysis that up to 60,000 breast cancers can be prevented, and a similar number of colon cancers can be prevented in the United States alone with modest doses of vitamin D of 1 to 2,000 units. Now I have done other programs on vitamin D on this encyclopedia. Please watch those programs for a fuller picture. But here I want to focus on one thing. When these feared profiteers do renounce their lies because it becomes impossible for them to protect anymore, they move on to other lies. There's a program on this encyclopedia, Do Vitamins Make Expensive Urine? It is pathetic and deeply saddening that I have heard this expression from oncologists' mouths as well as other doctors. Oh, vitamins, they just make expensive urine. They were ignorant. They were never studied nutritional medicine. They never practiced nutritional medicine. They never carefully listened to the patients, tell them the stories who were taken care of by clinical nutritionists. And yet they were ready, shooting from the hips, perpetuating the lies. You know what is the most saddening part of this phenomenon? That these doctors themselves know that these trials published by drug companies in journals like the New England Journal of Medicine, the Journal of American Medical Association, the British Medical Journal, they are controlled by drug companies, not by doctors hired by them to do the studies. How do I know? Because the chief editors of these journals have editorially admitted that the data that they published of these trials is controlled by drug companies, not by those doctors whose names appear on those articles. It just goes on and on and on. But when they do renounce a specific lie, for example, vitamin D, the role in prevention of cancer, they never have the courage to then go back and say, but this is what thoughtful, well-read, intelligent, diligent physicians who practice nutritional medicine have been saying for decades, and we've been insulting them. The New York Times, for example, has yet to publish an article deploring the fact that they themselves have been participating in perpetuating the lies that vitamins are not necessary in prevention or treatment of cancer. And the only reason, I am pretty sure that if you were going to talk to some lapdog Joes at the New York Times or Washington Post or the Wall Street Journal, they will tell you, if you talk to them at cocktail hours when they have a couple of drinks, they will tell you they are aware that drug companies deliberately deceive people by distorting and massaging their data. I think it is important when we think about our children that we expose these deceptions, tear down these curtains of darkness pulled on the eyes of parents by fear profiteers of the disease maintenance system in the United States. Do you know, can you guess, how much of my time actually goes in when I am seeing patients? It actually is wasted on the lies that have been told to them. HDL is a good cholesterol, LDL is a bad cholesterol, vitamins make expensive urine. Please look at these other segments. I think it is equally important to advance understanding and knowledge. We are focusing on issues of children, but you cannot reach the issues of children, their mental health, physical health, spiritual health, without first reaching their parents, their teacher, their grandparents, or the public policy makers in any given society. Children's Health Corps is a non-profit foundation founded and funded by Talat, my wife, and I some years ago. Our vision and mission is to provide authentic information focusing on issues of toxicities of foods, environments, and thoughts for children all over the world, as well as their parents, grandparents, teachers. The official website is www.kids123.org. kids123.org. Please support us, forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contacts. Should you wish to participate in our vision, visit our website. There is a page entitled, How Can I Help? Or you can just Google, How Can I Help? And then add Kids123, and Google will take you to that page. And we make some suggestions. We invite you to participate in our vision so that it becomes your vision. It becomes vision of every parent on the planet. Until we meet again, may you be gracious, graceful, and generous in your spirit. Thank you.